Hi, I'm Brian Miles. Thanks for joining us today. We're going to talk to Glori Traeder, who is a nurse practitioner with Quincy Medical Group. This month is National Breast Cancer Awareness Month. Thanks for joining us, Glori.
Sure, of course.
Tell us about the importance of early detection with breast cancer and the importance of scheduling a mammogram and such.
Okay, well, breast cancer is one of the leading causes of cancer in women. It's extremely common, and we're finding that it's occurring in women even younger than we used to expect. So it's super important to know your own body really well. Self-breast examinations are still really important. Just be an expert on yourself, know the different variations of your own textures and skin changes. Also having yearly annual exams with either your gynecologist, obstetrician, or family practice person is as important. And then the screening occurs somewhere around the age of 40 for mammograms. It kind of is, I'm not real familiar because it changes what the screening age is, but there's recommended screening for women in that age group all the way on into their 70s or so for with mammograms.
Now, if someone has a mammogram or finds something and it comes back that they do have breast cancer, what are the treatment options that are first available?
Oh, there's so many options. There's absolutely no cookie cutter approach to breast cancer treatment. There just is no one way to go about this. So it really actually takes kind of like a symphony of people who become involved once a woman has a diagnosis of breast cancer. It starts with the person who advises the woman that she has a diagnosis of breast cancer, and then it goes on into the specialized departments of oncology, radiation oncology, general surgery, plastic surgery. There's so many people and specialties, nurse navigators, breast cancer, centers and such that become involved that it's impossible to say what exactly would be the next step for that particular woman.
Reconstruction has really become a big option, hasn't it?
Well, it's been an option for a long time, but there's 7 out of 10 women in the United States are not made aware of the reconstruction options, and that's one of the things we do up in plastic surgery as part of a 3-year campaign started with the American Society of Plastic Surgery. It actually started in Canada to help women become more aware of breast reconstruction options. Last week we had Bra Day, Breast Reconstruction Awareness Day, to help women become more aware when they're diagnosed with breast cancer that breast reconstruction is available. It is supported through federal legislation to give women the freedom of having reconstruction without fear of not having it reimbursed by their different insurance companies. So our goal is to help women to know that reconstruction is available, and that there are so many ways to help women look and feel like themselves. Right.
And I would imagine support groups play a big role in that as well.
There are several support groups available in Quincy. They're so important, and there's also counseling and social workers, and as part of the symphony of people and support that's available for women with this diagnosis, because this is nothing anybody ever expects, and many women have small children at home, and they're in the workforce, and they've got loving families, and they really don't want to be out of their regular family group in order to go through this type of treatment. So we try to keep them as involved in the local area as we can.
Well, we're glad you're here to do that. We thank you for your time.
Sure, thank you.
It's Glori Traeder, nurse practitioner with the Plastic Surgery and Reconstructive Department at Quincy Medical Group.